Thank you, Lorna. Does anyone have questions for Lorna?
Just wondering if this would be on the website.
I hadn't thought about that, but we could do that. Yeah. Thank you. With all the references.
Thanks for that. Very, very comprehensive. I feel like we've been on quite a historical journey from the beginning of that presentation. You've covered an amazing amount, and I really thank you for your time in presenting that paper. Join me in thanking Lorna, please. Oh, one more question.
Thank you, Lorna. As someone who also worked through the 70s and was involved in the establishment of a women's health centre, but this time in a rural setting in Wagga Wagga, and now working as in the official visitors program, I see so many connections with the sorts of struggles that we went through in establishing that whole system within a rural environment. Often feeling that it was just the conservatism of rural environments, but I understand that the conservatism is much, much broader than in rural areas. As our program looks at a lot of the key issues that you've raised, that issue of safety, particularly of women in the mental health system, I find that there is a huge resistance to actually facing the issues. I've often wondered, and I mean these are my observations and I might really offend people about this too, but often it is because I see that there are so many males involved in the management of mental health units, and that I've been trying to encourage the official visitors to encourage attendance at the sort of training that you're talking about, that very often it falls on deaf ears. And I feel that there's often a response in the males that somehow there is a resistance because they feel like they're being accused of something themselves. And I think they probably are being accused of not actually responding to the needs that are before them, rather than necessarily saying they're all perpetrators. But we're all perpetrators in many ways of one thing and another, and we're all victims. And somehow we need to be able to have that dialogue without that terrible resistance that comes that says it's out there, it's not here. It's exactly the same debate we're having about climate change at present. It's that innate wanting for a terrible reality to not be happening, and somehow we have to be able to deal with the fear of people and acknowledging how pervasive the system really offends against so many of the people that they desperately want to help. So that's a comment I make.
Lorna, I've got another question for you. Yes, you can't go yet.
Good. I've had an association with CASA in Victoria that changed from a feminist model to a governance model. Do you think that's disempowered the thrust of the feminist movement in the process?
I might just come back to this. Look, I would have to say that I think it's important to hold feminist understandings, and feminism has broadened out to include, a much broader understanding around the intersections around age, gender, around culture, ethnicity, etc. So I think it's a very worthwhile model. What I've noticed, and I think what concerns me when I look at violence prevention services, is that the professionalisation of some of that means that we've lost some of the commitment to the client work, and that focus on belief and standing beside women, children and men. I think it does take a social movement to do that, whatever you want to call it, and I think it's important that we hold that philosophy in the work that we do. It does bring passion and commitment, and I think that is carried on to the clients that we work with. They can see that. Thank you.
Lorna, sorry. Lorna, just get back here.
Sorry, I know morning tea's calling. I come from the homelessness sector, and quite often we see the echo of child abuse in homelessness. the question I'd like to ask is, as a bureaucrat, is there any potential for better crossover in service provision between mental health and homelessness support, so that we can help heal the trauma from past?
I think that that's such an important question. We certainly know that if we look at the pathways into homelessness, child abuse is certainly one of the big predictors. And it links up then with mental health problems that also links into homelessness, drug and alcohol, and again we're seeing that cycling across. We do need to make those pathways. There needs to be resourcing for it. I think homelessness, how can you work with someone around their issues if they're homeless? You know, we have to start with the basics, and that really is about shelter and care. And I think it's critical that we begin those processes. What I would say is that ECAV's starting to look at trying to develop cross-agency training, because what we're finding is as we bring one service, let's say health, to try and work with other services such as community services or police, the culture itself seems to create a real problem in working effectively together. And so I think we need to promote interagency meetings and interagency training, but definitely more service provision into your sector. You certainly need it. Yeah. Thank you. I'm happy to talk to anybody at the break.
Okay. I actually just want to make a clarification just around the Victorian model.
Yep.
For centres against sexual assault. They are actually all non-government agencies, and they are as not so much federated as they are governed through the CASA Forum. So I guess just to bounce off that comment around a distinction between feminist models and governance models or business models, there's also a question about funding arrangements and what the relationship is between the sexual assault services and your providers. And within Victoria, being Victorian, but also having the opportunity to see national funding models for centres against sexual assault, what I see is a very strong and robust relationship between the CASAs and governments. So, and that's because they're not actually part of government. So just want to clarify that.
Thank you very much, and thank you again, Lorna. Let's give her another round of applause.